We begin with the part 2 of the CPT medicine, where we are going to target the topic like dialysis, ophthalmology, and otorhinolaryngological services. So the first topic is dialysis, and in that, first let us understand in short what is dialysis. It is the treatment for the people whose kidneys aren't working. When you have a kidney failure, your kidney don't filter blood the way they should. As a result, waste and toxin build up in your bloodstream. Dialysis does the work of your kidney by removing the waste product and excess fluid from your blood. And there are two kinds of dialysis which we are going to study. One is hemodialysis and second is peritoneal dialysis. So this is the hemodialysis and this is the peritoneal dialysis. In the hemodialysis, it is basically filter and clean the blood of a people with the kidney failure outside the body. While the peritoneal dialysis, we use the peritoneal membrane located inside the abdomen. So here, the solution remain in the abdomen for a specific amount of time, and then you can drain out that solution. That's the basic difference between a hemo and peritoneal dialysis. Now let us look at the code. So first we are going to understand the hemodialysis, and for which we have the code 90935 and 90937. These are reported to describe the hemodialysis procedure with all evaluation and management service related to the patient renal disease on the day of hemodialysis. Now these codes are used in the different setting. So in which setting I can use the 90935 and 937. So here I have given the list: inpatient end stage renal disease patient, inpatient non-end stage renal disease patient, and outpatient non-end stage renal disease patient. So this code we use it for that. In that, 90935 is reported if only one evaluation of the patient is required related to the hemodialysis. 90937 is reported when the patient's re-evaluation is required during the hemodialysis procedure. And 90940 is for the evaluation of the blood flow. If the ENM service is separately ENM service is given, then we use the modified 25. So this is very important, that where what is the hemodialysis 2 code. I mean, there is a third code also, and in which setting we use them. Now let us come to the peritoneal dialysis code. We have two code 90945 and 90947, and the distinction or the differentiation is pretty much the same. If there is a one evaluation, we use the code 90945, and if there is a revaluation, we use the code 90947. And modified 25 is used if the evaluation and management is separately identifiable on the day of the procedure, because we do the ENM which is related to the peritoneal dialysis, which is included. But if it is a separately identifiable ENM that is done by the doctor, then in that case we have to use the modified 25. Now let us understand the dialysis services for the ESRD patient in the outpatient setting. In that we have a monthly service code. These codes are 90951 to 90962. These are the full month services. Report the code once for the month. The codes based on the patient's age and number of the face-to-face visit performed during the month. And it requires at least one complete assessment visit during the month. What is complete assessment? A complete assessment, it is a proper evaluation of the patient's condition and then the dialysis needs. It is done by the physician or qualified healthcare professional. Now let us see the less than full month service. If the patient was on dialysis for less than full month but had at least one complete assessment, then we can use the monthly ESRD code. This is a very important statement, that the service may be less than full month but he had one complete assessment. That time we can use the monthly ESRD code. This we select the code according to the number of the visits provided during the partial month. So this is a very important statement, that the partial month service, we can code it by the full month code if there is a complete assessment. So let us study the code carefully. These are the code for the ESRD monthly service, and if you look at the codes are divided into the group. Here the age group is 2 years, and then again they are divided depending upon how many face to face. So this is a 4 face to face, 2 to 3 and 1 face to face. Now this is the second group, which is 2 to 11 years old, and again the codes further classified depending upon how many face-to-face visit. So for every group you will see that there is a age and the patient age and face-to-face visit that will decide your code. Now the next set of codes, that is 90963 to 90966. All these codes are for the home dialysis. These are again also the age specific code, but there is no face-to-face visit here, and this is once per month for the full month of the ESRD service. So all these are the home dialysis code. Again they are age specific code, and these are we write once per month. Now let us look at the code for the partial month of service or less than full month. The codes are 90967 to 90970. These report per day for less than full month service. Applicable in these circumstances: partial month with one or more face-to-face visit without complete assessment. Now this is very important thing, because if the service is partial month, but if the complete assessment is given to the patient, then we consider the full month service code. But here the service is partial month and even the complete assessment is not given, then we come to this code. Or the patient is hospitalized before a complete assessment was provided, dialysis stopped due to recovery or death, and patient receives a kidney transplant. In all these cases, we use this code. And if you see the code language, you will see that these codes are also age specific. So depending upon the age of the patient, we pick up the code from here. So let us look at the key reporting principle. First is a complete assessment. Codes for full month service require at least one complete patient assessment during the month. Second is face-to-face visit. Partial month or per day code require at least one face-to-face visit. The third is age-specific code. Always use the code reflecting the patient age when reporting the monthly ESRD. Hospitalization and transition. Adjust coding if the patient is transient, hospitalized, recovers or receives the transplant. Then the evaluation and management. ENM service unrelated to the ESRD, if performed during the dialysis, can be reported separately with modified 25. And the last is monthly reporting period. For reporting purpose, each month is considered 30 days only. All these are very important uh, key reporting point. Now, in dialysis, what we saw is, despite the different kind of dialysis, the setting also plays important role. So, I'm going to give you one example for you to understand it rightly. ESRD related service are initiated on July 1st for 57-year-old male patient. On July 11, he is admitted to the hospital as an inpatient and is discharged on 27 July. He has had a complete assessment, and the physician or other qualified healthcare professional has performed 2 face-to-face visits prior to an admission. Another face-to-face visit occur after discharge during the month. Now you look at this calendar, 1st to 11th. Where was the patient? He was outpatient because he was not admitted. Then from 11 to 27, the patient was inpatient. So 11 to 27, the patient was inpatient. Then he was discharged and then he becomes an outpatient. So 1st to 11 outpatient, 11 to 27 inpatient, and 27 to 30 outpatient. I hope you understood this very clearly. Now let's see next. So let us look at the answer. So first of all, the age of the patient is 57. Secondly, how many face-to-face visit? So you will see here that there are two face-to-face visit happened prior to admission and one face-to-face visit happened after the admission. So three face-to-face visit. And what was the setting? First was the outpatient, then he became outpatient, then he became inpatient, and then he became outpatient. So outpatient service was not full month service. But there is a mention of the word complete assessment. So though the service is not a full month, we are considering as a full month service. So now we are considering the full month service. The age of the patient is 57 and 3 face-to-face visit. So we can pick up the code 90961 because that will fulfill our age as well as the face-to-face criteria. And for the inpatient services, we are going to pick up the code from this because we do not have the complete picture when the patient was inpatient, what sort of dialysis was given. If it is a hemodialysis, I'm going to pick up the code from here. If it is a peritoneal, I'm going to pick up the code from here. Then again, I'm going to consider evaluation and re-evaluation. So those criteria will help me picking up the inpatient code. But for the outpatient, now you are very clear why we picked up only one code. So now we are going to take one more example. ESRD, I mean the same example, but I'm going to make certain changes. ESRD related services are initiated on July 1 for 57-year-old male. On July 11, he is admitted to the hospital as an inpatient and discharged on July 27. Patient did not have complete assessment. So we are taking the same example, but in the initial example, there was a complete assessment and here there is no complete assessment. And we know the guideline that whenever there is no complete assessment and if it is the service is not a full month service, we will have to code for each day. Now in this example, we are going to code 90970 which should be reported for each day outside of the inpatient hospitalization. And we always count the 30 days. Out of that, 17 days he was hospitalized and 13 days he was outpatient. So I'm going to code 90970 multiplied by 13, which is reported for the outpatient service. And for the inpatient service, I'm going to take the code from these four codes because there is no data whether it was a hemo or a peritoneal dialysis, whether there was evaluation or revaluation, but that we can depending upon the data, we will take the code from here. But what is important is to understand that here we do the multiplication because we code it each day. And if you remember the full month, we write the code only once. That's the difference. Now let us take some question in order to strengthen our guideline. A 8-year-old female had one face-to-face visit with her physician and receives 3 daily dialysis services in less than a month period to her kidney transplant. How these services should be reported? Now, what is 8-year-old female had one face-to-face visit with her physician and receives 3 daily dialysis services is less than a month. Now we are going to check all the code 90954, 968, 964 and 956. So what is the age of the patient? 2 to 11. So I will require this and it is less than a month. There is no mention of the word complete assessment. So we will look for the code which are for the daily service because it is not a full month. And in that case, we are going to count per day. So there are 3 daily services. That means we will require the multiplication. So go through all these options and tell me that. So yes, 90968 is for the patient 2 to 11. Our patient age is 8-year-old and how many services? 3. So we will go with the answer B. Let us take next example. Dina, an 18-year-old patient, underwent 4 daily ESRD services in the outpatient clinic before getting hospitalized. A complete assessment was not provided before Dina's hospitalization. How should you report a daily service? They have asked for the daily service. Age of the patient is 18 and it is outpatient clinic. So we need to code, and the complete assessment is not done. So we need to code the rather than the full month service, we need to code the daily service. So go through all the options and tell me the answer. So yes, 90969 is the answer because age of the patient is 18 and we are going to multiply it by 4 because we count per day per ESRD service. So let us take the next question. This 24-year-old male patient is on a continuous peritoneal dialysis using 1.5 dialyzer. He drains more than 600 cc urine. He is tolerating dialysis well. He continues to have some abdominal pain, but his abdomen is not distended. He has some diarrhea. His abdomen does not look like inflamed. His vital, other than the pressure, is in the 190 over hundreds are fine. He is a febrile. At this time, I'll continue with 1.5% dialysate. I gave him Labitol IV for the blood pressure because of the diarrhea. I'm going to check the stool for white cell culture. Next, we will see what the primary physician says today. His HIDA scan was normal. The patient suffered from ESRD. Which of the following is correct code assignment for this inpatient dialysis encounter? So first thing first is we need to check what is the dialysis. It's a peritoneal dialysis. Then I do not see whether there was an evaluation done or no because there is no word of the revaluation. So I can eliminate the option C and option A because this calls for the revaluation. So in between B and D, we need to check the code and we need to find out the answer. So yes, B is the correct answer because this is the code for the peritoneal dialysis. This is the code for the ESRD, that is end stage renal disease. And remember, the diarrhea is not related to this condition. So we will have to mention that as a special symptom. Because if the symptom is not a part of the ESRD, we have to code that additionally. And that's why B is the correct. So let us take the next example. During the month of July, a 7-year-old patient with end-stage renal disease is followed by his nephrologist. The care provided by the nephrologist include monitoring the hemodialysis cycle, monitoring the patient nutrition, assessment of the growth and the development, and counseling the patient's parent. During the month of July, the patient was seen by his nephrologist at his office 3 times. What is the correct CPD code? So first of all, it is a hemodialysis. Secondly, there is a complete assessment because all this thing, the monitoring the cycle, patient nutrition, assessment of the growth and development, all this comes under complete assessment. So the complete assessment is done for the patient where what is the setting? It is office. So it is outpatient and it is a ESRD patient and 3 face-to-face visit. So you have all your data, put that data and tell me the answer. So yes, A is the correct answer that we are going to take the full month service and then the full month service code we write only once. And those codes are age sensitive as well as the face-to-face visit. So look at this code. This is for the 2 to 11 years and 2 to 3 face-to-face visit. And that's what is our patient's criteria is. And that's why A is the correct answer. A patient with a chronic renal failure is in hospital and being evaluated by the endocrinologist after just slicing the catheter into the peritoneal cavity for dialysis. The physician is evaluating the dwell time and running fluid out of the cavity to make sure that the volume of the dialysis and the concentration of the electrolyte and the glucose are correctly prescribed for this patient. What code should be reported for this service? So if you look at the code, the first 2 code, they are for the hemodialysis. In our case, in our patient case, it is the case of the peritoneal dialysis. So we are going to pick up the code from instead of A, B, we are going to see the code C and D. And there is no mention of the re-evaluation. This is the first time doctor is seeing everything, but he is definitely evaluating the patient for the glucose and electrolyte. So D is the correct answer. Next comes the General Ophthalmological Services Code and the ENM code. So basically, you will see that the ophthalmological services are classified into the intermediate services and then the comprehensive services. The ophthalmological general services, they are divided into the intermediate and comprehensive, and here we have the division into the new patient and established patient. The criteria for the new patient and established patient is pretty much like the ENM, like the 3 years is what we considered. But remember, we never use the ENM code, that is a 99,000 series for the ophthalmology. For that we come to these codes because these are the codes which are only for the ophthalmology, and in that we have two codes in the new patient and two codes in the established patient. So let us understand what is this intermediate services. Evaluation of a new or existing condition complicated with a new diagnostic or management problem, which includes the review of history, external examination, ophthalmoscopy, biomicroscopy, typically applies to acute complicated condition not requiring the comprehensive service, like conjunctivitis, corneal abrasion, or acute foreign body. Well, as far as the comprehensive services are concerned, they always include initiation of a diagnostic and treatment plan, but may involve the prescription of the medicine or arranging the specialized ophthalmological diagnostic and or treatment services, which applies to the chronic, complex and systemic condition. For example, cataract evaluation, glaucoma management and diabetic retinopathy. So this is the basic difference between an intermediate and comprehensive. So remember, there are certain bundle services in the ENM code for the ophthalmology. So what are those bundle services? One is the slit lamp examination, tonometry, which is used to see the pressure, routine ophthalmoscopy, retinoscopy, keratometry and ocular motility evaluation. All these are bundled in the ENM code of for the ophthalmology, and they are separate code which we saw just now. Now let us take some questions, and as far as the eye is concerned, pay attention to the language of the code. So patient completed a diagnostic computerized ophthalmic scan of the retina and on both the eyes. The physician interpretation and report include changes to the retina in the right eye from previous studies. The left retina looked stable with no changes noted. The patient is scheduled for follow-up study in 3 weeks to assess any new changes and the treatment as needed. How should the physician report her service? Now we have the code. So if you look at the code 92132, it is a scanning computerized ophthalmic diagnostic imaging anterior segment with the interpretation and report unilateral and bilateral, and here it is a scanning computerized ophthalmic diagnostic and imaging posterior segment with the interpretation. So first we need to find out whether it is the anterior or the posterior segment and changes in the retina. So there has to be posterior segment, and in this case we need to check now what is the correct code and what is the correct modifier here. So kindly go through all the codes and tell me the answer. So yes, 92134, it is because there is ophthalmic scanning of the retina of both the eyes has happened. So we will require a code 92134. But there is no need to write a modifier 50 because this is the indented code. And if you read the code, scanning computerized ophthalmic diagnostic imaging posterior segment with the interpretation and report unilateral or bilateral. This is for the optic nerve, this is for the retina. So the language of the code uses the word unilateral or bilateral, and that time we do not use the modifier. So C is the correct answer. Next question is, what additional services can be reported in addition to the general ophthalmic services or evaluation and management services? So in this case, you have the intermediate ophthalmological services, only established patient general ophthalmological, special ophthalmological services, and only new patient general ophthalmological services. So kindly go through all the options and tell me the answer. And the answer is the intermediate ophthalmological services, because the general ophthalmological services, they are divided into the comprehensive and the intermediate. So A is the correct answer. Now the next is CPT coding for the otolaryngology, that is ear, nose and throat, ENT. Now, as far as the ENT is concerned, the basic diagnostic services are included in evaluation and management. And what are those? These procedures are considered the part of the ENM service and should not be separately reported, like the otoscopy, examination of the ear, or anterior rhinoscopy, examination of the nasal cavity, or tuning fork test, that is the hearing test, or removal of the non-impacted cerumen. These are the diagnostic and some of the very basic treatment which are included in the ENM, and we do not code them separately. While there are certain special otolaryngology services which are not which we cannot include in the ENM, and we need to code them separately. For example, complex diagnostic tests, specialized treatment procedure, advanced evaluation that go beyond the routine ENM, an office or outpatient consultation not included in the standard ENM. When this happened, we code them separately. So the routine diagnostic procedure, they are included in the ENM. Special otolaryngology services, we need to code them separately, depends on case to case. Speech and swallowing evaluation, we have a separate code 92507 to 92526. Kindly read the code language very carefully. And many a time during this ENT checkup or the procedures, there is a use of the microscope. Some of the code includes the use of the microscope, some of the code does not include the use of the microscope. So read the parenthetical note clearly in order to understand that. So let us take one question. A 10-year-old patient had a recent placement of the cochlear implant. She and her family see the audiologist to check the pressure and determine the strength of the magnet. The transmitter microphone and the cable are connected to the external speech processor, and maximum loudness level are determined under the programming computer control. Which CPT code should be used? And we have this particular option. So kindly go through this and tell me the answer. So if you look at this four code, these are the code for the cochlear implant, and the code divided depending upon the age. This is the code for the younger than 7 years, and this is the code for the age 7 years or older. Our patient age is 10 years, and in this case diagnostic analysis of the cochlear implant age 7 years and older. So we will pick up the answer 92603. So let us take the next question. Colin had a comprehensive audiometry threshold evaluation and speech recognition testing for the to the left ear. What code captures this procedure? So we have the speech audiometry threshold recognition, and this is for the comprehensive audiometry threshold evaluation and speech recognition. So we have a code for the comprehensive audiometry. 92700 is an unlisted procedure. This is a listed procedure. We have a separate code. So we are going to use the code 92557. But remember, there is a guideline here. All services include testing of both the ears. Use modifier 52 if the test is applied to 1 ear instead of 2 years. So now you have all the data in front of you. Tell me the correct. Now, next question. What codes capture the procedure of a comprehensive audiometry threshold evaluation and space recognition testing to the single ear? and you have this code, and then the option tell me the correct answer. So yes, D is the correct answer, and here we are going to pick up the combo code, which includes both the auditory threshold as well as the speech recognition. And you remember that we have the guideline that if we have a combo code, that we select over the individual code. And this is my last slide, and then I'll see you in the part 3.